Hello, my name is Edward Med Kamara. I am doing a presentation on HIV/AIDS etiology of pathologic condition for G150 Section T, Structure and Function of the Human Body 2014 fall quarter. This is a requirement for this particular course for this quarter. A HIV/AIDS pathologic condition, which is acquired immune deficiency AIDS and human immunodeficiency virus HIV. Most complications of HIV/AIDS are as a result of a suppression of the T cell mediated immunity. This particular virus attacks the entire system of the human body functions, and ART is available to inhibit the replication of the human immunodeficiency virus. Indeed, early use of the ART has increased survival to near normal duration and dramatically reduced the risk of developing HIV and AIDS. There are several signs and symptoms of this virus. It ranges from the malaise, fatigue, weight loss, chest pain. It goes to loss of hair, most cases body rash, and loss of normal appetite. It could also lead to serious odor from the breath of the affected HIV/AIDS person, and is additional sign of damages to the internal organs like the lung, the liver, and the kidney. The virus affects critical body organs and functions, as patients with AIDS have their immune system completely depleted and are very exposed to other related infections like tuberculosis, and it is really terrible. The virus can be treated, and like I earlier stated, the ART can reduce the risk of death if committedly and regularly being taken by the patient, and early use has actually increased survival to near normal duration, and like I said, dramatically reduce the risk of developing the AIDS. The ART treatment has considerably improved the recovery situation in affected patients if administered consistently and frequently in an affordable fashion. But this treatment cannot completely eradicate the virus from the body of the patient, and the virus may continue to remain, though at low levels in the body. This requires constant post-treatment recovery follow-up activities and at the treatment centers or affordable hospices where the patient will be looked at and monitored for general awareness and welfare of his growth and development. The virus can be prevented in a couple of ways, and the following are specific preventive mechanisms outlined. 1. Complete abstinence from having unprotected sexual intercourse. 2. Avoid direct blood contact with affected persons. 3. Stop the use of unsterilized instruments like blades, needles, syringes, and related items for either injections, piercing, shaving, breeding, or blood transfusion. HIV has short-term and long-term effects on the nervous system, and most patients dying of the disease are historically connected with brain damage. Some of them develop cognitive, behavioral, and mental abnormalities. In short, the level of memory in the cortex and the mental ability reduces. In the long term, there is a rapidly progressive convulsion and dementia as the situation worsens in the patient. The virus also reduces the ability of the body to resist the infections and can quickly complicate other diseases that may affect the HIV and AIDS. For example, fibrinogen will completely be lacking, no blood clotting will continue taking place in the affected person if not really properly treated by ART. And of course, a lot of tuberculosis will show up, and this will weigh down heavily on the weight of the patient and will lead on to it will slow down the movement in the affected person, and of course the temperature will regularly increase, and this will contribute to a lot of related problems. So these are some of the excesses that the virus will have on the affected person if not completely addressed by ART in the early stages to reduce the risk dramatically. Thank you very much for listening to my presentation.